brachial plexus. It comprises of C5, C6, C7, C8 and T1. So we draw them as just 5 horizontal lines. It is C5, C6, C7, C8 and T1. Very easy to remember. Then we join the upper two and the lower two and we increase their length. Then next we again divide them into two and then we join the lower three and the upper two and the middle one continues alone. Now we will name these. These are the roots. This is the trunk and these are the divisions and these are the cords, and further we have branches. So C5 is the only root which gives 3 nerves, 2 above and 1 lower. They are accompanied by C6 and C7. It is the nerve, it is the long thoracic nerve, and the upper two which we can see, they are the phrenic nerve and the dorsal scapular nerve. It is the only trunk, the upper trunk, the middle trunk and the lower trunk. Among these 3 trunks, the upper trunk is the only trunk which gives 2 branches, that is the suprascapular and nerve to subclavius. Suprascapular nerve and nerve to subclavius. Then we come to the cords. The upper lateral cord, it is called the lateral cord. It is the medial cord and it is the posterior cord. Now we use the pen. Lateral cord continues as musculocutaneous nerve. It gives one branch, that is the lateral pectoral nerve, and it combines with the medial cord to form median nerve, and the medial cord itself continues as ulnar nerve, and it gives 3 more branches, that is, one is the medial pectoral nerve. For lateral cord it is the lateral pectoral nerve, and for medial cord it is the medial pectoral nerve. And here we have the 2 nerves, that is those are the medial cutaneous nerve of arm and medial cutaneous nerve of forearm. So we can remember them easily as they are the medial cutaneous nerve of the arm and the forearm. Now the posterior branch. The posterior branch itself, after giving all the branches, it continues as a radial nerve, and it gives 4 branches. Its branches are axillary, we can name it on the upper side so that we have space, axillary nerve, and 3 lower, they are subscapular that is upper subscapular nerve, lower subscapular nerve, and this is the nerve to latissimus dorsi, lady between two majors, that is its insertion is on the humerus along the outer lip and lower lip. Okay, so there its insertion, and now to latissimus dorsi, a very big, large, huge muscle on the back. So this is all about brachial plexus. One important point to be noted, that from the lateral branch of the median nerve there runs a communicating branch between the lateral branch of the median nerve and the containing part of the medial nerve, that is the communicating branch. So we can easily remember these as there are the formula you can remember either by some mnemonic or it is as RTDC. First is the roots, then is the trunk, then is the division, and then are the chords, and then we have the branches. Okay, here the only root which gives branches, it is the C5, and it gives dorsal scapular nerve and phrenic nerve. Okay, and it also gives one long thoracic nerve which comprises of C5, C6 and C7. So these are the MCQ questions or exceptional cases which we can remember. And the only trunk, which is the upper trunk, it is the upper trunk, the middle trunk and the lower trunk. So it also gives, only the upper trunk gives the branches, that is the nerve to subclavius and suprascapular. So you can remember these two, dorsal scapular and suprascapular. And then when we come to the divisions lower on, we find the lateral cord, medial cord, posterior cord, and then here we have 4 branches with 1 nerve, here we have 3 branches with 1 nerve and 1 combining nerve, and just 1 branch and 1 nerve. Simple, all about the brachial plexus, isn't it?